This feels good. Whew. Did you know that 150 minutes of cardiovascular activity a week lowers your overall mortality rate by 20 to 35%? Now, think about that for a second, right? Now, that's 5 30-minute sessions a week or 20 minutes a day. And if you're telling me, hey, I don't really have that time, I want you to look at your screen time on your phone. Tell me that you don't look at it for at least 20 to 30 minutes a day. Then I'll kind of believe you on that one. Overall, peptides are not going to help you lose weight unless you're putting in the activity outside of the peptide as well as inside of the kitchen, in the gym, and in your day-to-day activities. Peptides can only do so much. However, if you are already physically active or you're willing to start, peptides are an easy and great way of adding to that amazing regimen to make that results even stronger. The two peptides that get the most questions about are Sermorelin and Tesamorelin. Now, both of these peptides act upon your pituitary gland to naturally release more growth hormone. What that growth hormone release does is promote more lean muscle mass, as well as quicker recovery after a workout, after strenuous activity, 150 minutes of it a week, hopefully. And it also helps with longevity, overall health, helps reduce subcutaneous fat. Sermorelin particularly helps with the subcutaneous fat, typically reaching about 5 to 8% of a loss by month 3. Tesamorelin acts upon your visceral fat, which is inside of your abdominal cavity, which is actually the riskier type of fat to have. It's linked to more cardiovascular diseases as well as organ damage because it's sitting around your organs causing that chronic inflammation. Now, both of these are injected subcutaneously right before bed because, again, it's supplementing that natural growth hormone release, which usually happens when you're in your deep sleep realm. There's different types of sleep, like REM sleep, deep sleep, core/light sleep. Deep sleep is when you're going to be releasing that growth hormone. And when you inject it subcutaneously at night, that's when you're getting the best results of that natural growth hormone release. Sermorelin is a 29 amino acid chain peptide. And because it's a shorter peptide, where Tesamorelin is 44 amino acids long, it actually is a little bit more of a gentler approach. It pulses your growth hormone in a very slow, gentle way, leading it to have a safer risk profile, as opposed to Tesamorelin, where it's going to have a stronger growth hormone release, which actually leads to a higher risk profile. What are those risks? Typically with people with diabetes and an uncontrolled A1C, does have the risk of making that a little bit worse. Tesamorelin also has the risk of what's called edema, which is swelling, typically in your extremities. Research shows that it is possible to even get carpal tunnel syndrome because of that edema, because it'll put pressure on your medium nerve, causing symptoms in these 3 fingers. Now, usually when you cease the treatment, those symptoms go away with it. However, if you have carpal tunnel syndrome, you have diabetes, you have cancer, if you're pregnant, if you're breastfeeding, these are all contraindications to both Tesamorelin and Sermorelin. Tesamorelin a little bit more for that diabetic and the edema risk. Sermorelin is typically injected nightly, where Tesamorelin, again, because it's more aggressive, can be injected 5 nights out of the week. Typically, I say Monday through Friday to keep it a little simple. Every other day is great too. Also, Sermorelin was technically FDA approved. It was used for dwarfism in children. Tesamorelin is also FDA approved for what's called lipodystrophy, which is the abnormal storage of fat, particularly in that abdominal section for HIV patients. So though these peptides have particular FDA approvals for certain issues, they're not FDA approved for those longevity and for those health benefits that a lot of people are starting to use them for. With that being said, it's important that you're getting your sources from a compounded pharmacy, which you know would be from a safe source, just like BioRestore gets it from. Again, BioRestore offers amazing peptides that can give you a grand of different symptom relief or benefits towards your health and towards your overall longevity in life. Sermorelin, Tesamorelin also have a nice longevity profile when you take them for a longer period of time, even though they should be cycled appropriately. Um, they have um, the advantage of actually increasing your longevity in life, which is how long you live, how well you live, as well as your skin thickness, which helps you look a little bit better too. Hey, hey. There's many considerations that you should take when considering which peptide is going to work best for you. And it's very important to sit with a healthcare provider to sort through those questions and different ideas of how you should stack things and how you should use them for your own health conditions. This really is beautiful, isn't it? You know what would be even more beautiful? If you were taking Sermorelin or Tesamorelin.